Okay, I'd like to call the Human Services Committee meeting to order and welcome those visiting us live streaming this morning. We have 4 information items, this morning, so I will turn it over to Christine.
Thank you. Through you, Chair. We do have a few items before you for your information. The first is with regard to the new affordable development proposal for 2018-19 year. And the staff report before you does explain that we are looking towards using a consultant to perform the evaluations for this round of funding release. There is interest for the county to perhaps apply for the funding in this round, and so we would like to use an external consultant so that there is opportunity to have an objective review of any proposal that comes forward, whether it's from internal or external proponents. And I'm happy to answer any questions if there are any on that.
Any questions? Hearing none.
Okay, so moving on to the information report regarding the early on spring guide. It's an exciting time in the transformation of early year services for Bruce County, and I did circulate an actual hard copy for each of the counselors at your desk. That full guide is available online at the link that's included in the report. And so you'll see that there's exciting stuff happening in our early years programs right across the entire county. And again, happy to take any questions if there are any.
Any questions or comments? Moving on.
Okay, with regard to the next report is the Social Assistance Modernization Update. And so as you're aware, the Ministry of Community and Social Services has committed to modernizing social assistance. Included in the information report is a link to the full income security reform information, because this is in alignment with a broader government benefits transformation and human services integration. So social assistance modernization is one piece, and of course the tasks that are occurring in 2018 are in our business plan, and we will update you quarterly as those come out and we implement them. In particular, we're aware of a couple things that are changing that are in the report now, which includes the paper drug card discontinuance, which is really effective in streamlining services and also just making it easier for our clients that they're not using something that publicly shows them as a recipient of social assistance. Instead, they're simply using their health card to access those benefits. So these are really important improvements that are happening. And if there are no questions on that, the last report, again an information item, is just to let you know that the evaluation committee did complete evaluations of proposals received for the Strategic Community Initiatives Grant for 2018, and that 2 initiatives, the Grey Bruce Poverty Task Force and the Community Drug and Alcohol Strategy, will each receive grants of $20,000 to continue that collaborative work in the community.
Okay, any comments or thoughts? Milt?
And this is back on the first one. With regards to, you said Bruce County is eligible to submit. So, we're to build new housing?
Yes, so the release of the funding that's available is for investment in affordable housing, and so that funding is to build what's considered the affordable category, which are units that represent 80% of average market rent. So if Bruce County is to submit and be a successful applicant with that program, it would be for the development of new affordable units, separate from any work that we might do with our rent geared to income or social housing units. But that would be specifically for investment in affordable housing. So those are where you keep the unit at 80% of average market rent for 20 years is what the basic requirement is for that program, and up to $150,000 per unit.
So do we know where we would be building?
So that would come forward in our proposal, which hasn't been defined yet, but we would be coming before committee with that. We just want to set the process up so that it leaves room for someone objective to take a look at the evaluations.
Anne?
I know you've probably explained this before, but I was just, so the Ministry of Community and Social Services has worked with, I'm back on the social assistance modernization update. So they've worked with delivery partners, such as the county, to develop a strategy for modernizing social assistance service delivery. So so I understood, like, we'd already implemented some changes, and so there are more changes to come from the ministry, and is it required, and is it kind of all throughout the province? And so where are we on that continuum?
Sure. So we're really just at the beginning, embarking on it. The roadmap is 5 years long, and it involves all social assistance delivery. So it includes both ODSP, Ontario Disability Support, that is directly operated by the province, by Ministry of Community and Social Services, and it includes all the 47 municipal service managers who deliver Ontario Works on behalf of the province. Ontario Works, we are a delivery agent. So many of the items that come forward are directives. There are certain business practices that we have opportunity to tailor to our local context, but generally it is a provincial program, and we're a service delivery agent. But there has been much consultation with us in terms of what's happening on the ground and how we can be effective in making change that actually does have an impact in people's lives.
So, thanks. And so then the funding, like, you are well funded for this. Like the funding, you get 80% funding, 90% funding?
So with Ontario Works funding, we are actually, the client assistance piece is 100% funded. This is where we've had the upload that's been happening for a number of years. And so the client assistance piece is 100% funded by the province. So any policy changes that they're making with regards to increasing benefits or other benefits being added is at a cost to the province. Where we share costs is in our administration, and generally right now that's 50-50 cost sharing for administration cost.
And what about training? Like, so you're assisting the client, so is training included in the funding of this? Like, say a client needs further training, or do you assist them to help go through another program to get training, because often they don't have the money for their own training?
So it is a hybrid. We do offer some in-house training ourselves.
Okay.
So we offer some workshops that occur through our staff delivering. We do have discretionary and other types of employment benefits within the client assistance portion, where we can fund items for clients as well. So say, for example, a client's in need of work boots to begin a job, so we can fund things like that. And then we also do refer. So VPI is the local employment service delivery agent, and so they have other programs that then, for example, someone was wanting to return for education, for a new career path, then that's where we would refer for funding for those sorts of things, as well as where it makes sense assisting clients in thinking about opportunities for things like Ontario student loans and different types of opportunities that might be available to them. So it really is a hybrid of us direct delivering, of us administering some benefits that come through the province, and then also referring to others that have a mandate in this area.
And it includes people with, a disability of some sort as well? It's not just restricted to certain clients, it's right across the board?
So any of the clients that fall within our mandate of Ontario Works, we're providing the full realm of opportunity of services to them. Once someone's been identified as having a disability and has moved on to Ontario Disability Support Assistance, then it is that staff group that assists them in any referrals. There are some pieces of our program, though, where we do have, for example, our discretionary benefits and the funeral coverage and those sorts of things that we administer for both ODSP and Ontario Works. So again, it is a little bit of a hybrid there.
Nothing's ever straightforward. Okay, thank you, sorry. I just was curious about that.
Okay, any other discussions or comments? Hearing none, motion to adjourn. Milt? Robert, all those in favor? Opposed, if any, that's carried. Thank you.